Hello, everyone. Fernando Hetiadra here, founder of Ignite Global, and I'm very excited to have all of you in this conversation. And I think this is an important topic that we are about to discuss today. uh, Intersections of coaching and therapy. Now, today I have very special guests with us, three of them. The reason why they are very special is because they are practicing coaches and also therapists and counselors. And so they have experience from both the worlds. They have experience from operating as a professional coach as well as a therapist or a counselor. So I think our panel today will be able to bring us a lot of understanding on what are some of the intersections, how do they move between these two really very similar, but also at the same time different professions. And in our network, we have many leaders, professional coaches, individuals who are committed to their professional development, therapists, and many other professionals. So I believe this panel discussion would create value for all of us. So with that excitement, I would like to also welcome everyone who is joining us live today and also those who are watching this video later online. So especially those who are joining us online, if you have any questions, feel free to send them through the chat room, and depending on how we have time, we will try to address as much as possible. And also, those who are joining online, as you're going through this conversation, this video, if you have any questions, feel free to leave them in the comment section, and I will invite our resource panelists today to look at them later and provide some clarifications and answers if you would like to. All right, so as we begin, I would like to very briefly share with you why I am here. So at Ignite Global, you're aware we provide coach-specific training, coach-related services, and also with our sister organizations, we provide therapeutic interventions. So for me, it is very, very important to position ourselves as an organization dedicated for new generation of coaching. What do we mean by that? As you are aware, coaching is a spectrum that is not necessarily fully regulated by governments around the world. When you look at many developed countries, there are certain regulations. But lucky for us, there are many organizations that provide some level of standardization, quality for our profession. So for an example, International Coaching Federation, European Mentoring and Coaching Council, and so on. And at the same time, if you also look at the world of therapeutic interventions like working as a psychologist, psychotherapist, clinical social worker, and many therapeutic professions are much more regulated in certain countries. At the same time, we also know that it's also not necessarily fully regulated. So for an example, I am based in Thailand and I am from Sri Lanka. Now, both of these countries have some level of alignment, some level of standardizations from government bodies, but not very well fully regulated. So operating within industry that is not fully regulated, it's important that as conscious professionals, especially working in the mental health care sector, bringing in awareness and understanding. So that's the reason why I am here. And in fact, if you look at some of the practicalities of coaching, some of our coaches work within the themes of procrastination, burnout, relationship or couples coaching, parenting, child, adolescent development coaching, and a spectrum of different types of coaching. Apart from the main specializations we have like life coaching, executive leadership coaching, and so on. So it's important that as professional coaches, we ask ourselves really important and responsible questions. So for an example, can we really turn a blind eye to the whole person when we work with an individual, when we work with a client? And can we completely ignore about their past, for an example? Can we completely ignore about their current mental and emotional state in case if they needed further assistance uh, beyond coaching, for an example? Because as you're aware, when we look at a human being, we are not just only looking at a person who meets you, who meets with a professional coach just then and there with their current situation and wanting to develop themselves. Now, when we look at the technical definition of coaching, that's how we approach coaching. We look at the person where they are, and then we enable them. We act as a catalyst in helping them move forward, achieve their goals, and resolve some of the situations that they may be facing. At the same time, however, can we completely forget about the influence on ourselves as human beings through epigenetics, ancestral DNA that we have been gifted from our ancestors? And then can we completely ignore our childhood experiences? As many of you are aware, many of our experiences as children we forget. And sometimes we forget these experiences because there are certain adversities or traumatic experiences around our childhood, many of us experience. And one of the coping mechanisms is to forget them. In other words, disassociate from them, for an example. So can we completely turn a blind eye to them? How about certain developmental aspects? And how about certain trauma and adversities individuals experience as children, adolescents, and even as adults when we approach our clients as a professional coach specifically? So these are some of the questions that I believe that we need to address as professionals who are in the mental health care um, arena. So with that, I would like to share with you, as I mentioned, we would like to position ourselves at Ignite Global as a organization which focus on new generation of coaching. And I believe particularly we have a responsibility. At Ignite Global, we deliver coaching specializations that go way beyond the traditional coaching frameworks. For an example, we deliver trauma-informed advanced coach practitioner certification, child, adolescent development, and parenting coach, advanced coach practitioner, trauma informed psychedelic integration, advanced coach practitioner. And as I mentioned these specializations, I believe you immediately recognize the importance of not only just focusing on the traditional coaching frameworks, but also looking into deeper understanding of how a person behaves and how do they heal, how do they move forward in achieving their aspirations in life. So with that, I believe as coaching is becoming more and more individualized, specialized, as the arena of coaching is expanding, if you're focusing on developing a specialization and standing out in within the coaching industry, it's important that we look at certain aspects of mental health care very closely. And that's the reason why today we have this panel discussion. So at Ignite Global, we intend to redefine, innovate, and pioneer the future of specialized professional coaching. And I believe you have an inclination towards this expansion that coaching is cultivating around the world, and that's why you are here. So now with that, I would like to introduce our panelists. So I would like to first introduce our panelists very briefly because I think our panelists are very highly qualified and they do a lot of interesting interventions in the professional within their professional capacity. So if I introduce them, I may not be able to do the justice. So I'm going to very briefly introduce our three panelists, and then I will invite each one of you to introduce yourselves with what you do very passionately in the mental health care space. So first, I would like to introduce to you Emily Bass. She's a licensed independent clinical social worker. So that's the therapeutic world. And then she's also an ICF professional certified coach. And then next, I would like to introduce to you Anita Nadig. She has a master's of arts in psychology, and she works as a counselor. At the same time, she's an ICF ACC and an author. And then I'd like to introduce to you Lauren Smith. She has a master's of education in community counseling, and she's also National Board Certified Health and Wellness Coach. So with that, I would like to invite our panelists to introduce themselves. Emily, over to you.
Hi, everyone. What a great crowd. This is amazing. Some faces are familiar to me, which is nice. So I'm here in northern New Hampshire in the White Mountains, and I basically have spent my career in the helping industry. Started with skiing, starting ski schools for people with disabilities around the country. And so that is a form of coaching. So a ski coach. And then when I went back to school and got my master's in social work and started working in the world of philanthropy. So more of a macro social worker working with larger societal issues, running programs to fund suicide prevention programs, child abuse and neglect, alcohol and drug prevention and treatment and those kinds of things. And then I ended up, I didn't care so much for the corporate world at that time of my life. And I wanted to be more independent with how I could expand my helping desires. So I started my own coaching business, and it's been almost 10 years now. And I do more of the executive and leadership, sales, those kinds of things. And I base my coaching around assessments. So using assessments like the DISC behavioral profile or emotional intelligence, motivators, the Hartman value, like the cognitive thinking, those kinds of things. I find it helps me to understand almost right away where there's a need for healing versus moving forward in coaching. And so I call it assessment-based coaching. And then, it's hard marketing yourself, as I'm sure you all know, and getting clients consistently. So I wanted something a little more consistent in that regard, and the interest in mental health and trauma informed care and trauma. I went into doing therapeutic work as a trauma therapist, and I find it just the most meaningful work. I just love it. So that's me, and I'm excited to be on this panel and hear from the others as well. Thank you.
Thank you, Emily. Very excited to learn from you. Next, let's hear from Anita.
Hi, everyone. Good morning, good evening. So, first of all, I would like to acknowledge Fernando for having a very nice opening to this, session, bringing out the blind spots, right? It's so important. So, yeah. So, I'm based out of Bangalore in India. As Fernando shared, I hold a master's in psychology as well as diploma in hypnotherapy. Along with ICF ACC, I'm a certified mindfulness coach for teenagers and young adults. I'm also trained in CBT. I'm also a trauma informed therapist. So, little bit into my career path is that I'm a engineer turned into a coach and a counselor. I call myself as a mind coach and emotional wellness counselor. As a child, I was very intrigued with the human behavior. And, it's a very traditional kind of education I was brought up in. And I did my engineering, joined a corporate, and played various roles in India and also in different countries. Over a period of time, this childhood question of questioning the human behavior, why people act the way they are, or why people behave in different ways in the similar situations. I was sitting with these two questions for a very long time. And once there was this technical era had come where the information was at the fingertips, I started exploring human behavior. That led me to read many books, join some courses, workshops. And when I looked around 9-10 years of corporate experience, I was realizing that I was spending a lot on learning psychology. That's when it was a very conscious decision that I'm very passionate about human transformation than digital transformation. And that's how my re-education started. I spent around 7 years educating myself with master's, diploma, and other certifications. And I slowly transitioned my career from being an engineer to coach and a counselor. And I work with adults, children, as well as geriatric population. My forte in counseling is anxiety management, be it for adults or children. And with respect to coaching, I have very niche areas. I work career transformation coaching is one thing, one area I work with, new manager transition, as well as mind coaching for children. That is my forte in coaching. Apart from the profile of coaching and counseling, I'm also an author. So I actively write on mental health for a couple of magazines in Bangalore. And also my third book, which was published last year, was about a guide for people looking for transitioning from one career to another career. It's called A Quest for a New Career Path, which comes with my journey, capturing my journey, and also a lot of self-awareness activities to find your passion, purpose, and how you can create a meaningful career out of this passion and purpose. And the upcoming this year, I'll be publishing another book called Mind Matters, which is all about, different mental health conditions, and what can a layman, how to recognize, understand these symptoms, what are the options to take professional help. This is I'm very passionate about fighting the stigma about mental health, especially in India. There is a lot of stigma, and my work is more inclined towards bringing awareness about mental health and making people to take professional help for the mental health. And that's a brief introduction about me. I'm looking forward to hear from others.
Excellent, Anita. Thank you. As you have transitioned through interesting professions, so we look forward to learning from your enriching experiences. And also, Anita, feel free to share the link to your book in the chat so that if anyone is interested, they can also gain access to it. And with that, I would like to hear from Lauren next. Over to you.
Hi, my name is Lauren Smith. I am currently located in Dallas, Texas. I started my career as an in-home family therapist. So from about probably as early as 11 or 12, when I finally recognized you had to have a job as an adult, I determined that my job would be in helping people. So I didn't know exactly what it was going to be. Initially, I thought it was a psychiatrist, and then I recognized I don't want to do any of the things that you have to do in medical school when it comes to human bodies. So I decided to step a little bit further back and go into psychology. So my undergrad is in psychology and my master's is in counseling. After a few years of being an in-home family therapist, I recognized that I needed a step back from working so deep with clients and especially with parents and families. So I moved into the nonprofit world and started working as a program manager for after-school programs and mentoring programs. And throughout that transition of stepping back and helping people in a different way, I recognized I did want to do one-to-one support a little bit more closely versus program management. And then just did a search really for careers that included the skill set of therapist. And I was unaware that coaching was a thing. So I found coaching, I would say, pretty late in my career and found health coaching. And so that really resonates with me well because I'm always trying to figure out how to make myself more well. And so I ended up doing um, not a degree, I'm sorry. I ended up doing a coaching certification in health and wellness after working as a health coach for a few years. And I really try to combine the space that I like, which is supporting people through transitioning with managing people and also taking care of themselves. So oftentimes people are thrust into these positions because they can do the job well, but that doesn't translate into leading people to do the job well. So I try to incorporate all of my history of the emotional well-being, the behavioral well-being into taking care of yourself, and how does that translate into actually doing your role and also supporting other people to do their role. So I really enjoy the conversations about the differences between therapy and coaching, because oftentimes in my community, as African American in the states, especially in the southern states, it is not always looked at as something that people want to do or people think is for them. And so coaching oftentimes is their first open door to receiving help. I transition a lot of people to therapy or help them to understand which components of their journey are appropriate for coaching and which components of their journey are appropriate for therapy. So this is a very relevant conversation for me. And I'm happy to be here.
Brilliant. And we're happy to have you here, Lauren.
Thank
And we're
you.
happy to have all of you here for this very important conversation. So I am starting to recognize really some interesting similarities between our panelists. For an example, we noticed that all three of you came from a different professional background, and then you transitioned through various of different aspects and ignited from a place of wanting to help people, accompany them through their journeys. And also, I'm celebrating not only the diversity among our panelists, as you very well see, and also was mentioned, and also the audience itself. We are a global audience, so being able to understand what is important within these two professions from different cultural backgrounds, different geographies, I think is a enriching experience. So I'm very excited to continue. So with that, I would also like to just invite you to recognize, as Lauren mentioned, none of us really knew about coaching maybe 25 to 30 years ago, unless you started really, really at the very beginning. Although, of course, coaching and therapy would go all the way back to the times of Aristotle, if not even further. I believe that coaching started getting recognized in the last 3 decades. So I believe that transition is something that has been part of not only our panelists, but it's a common experience to many of us. So I remember initially when coaching was introduced to me, particularly, which is about 20 years ago, when I had conversations with therapists and psychologists, they were like, what is this coaching? That was the kind of approach towards coaching. And then after 20 years, now we have several clinical psychologists who are going through our coach-specific programs and seeing the immense value in embodying a coaching approach in delivering therapy. I think in the therapy world, self-directed development is not something new. There are many self-directed approaches, the client-directed approaches, where the client find their own answers. There are multiple aspects. And even then, I see some of the psychologists, therapists, psychotherapists who often find the coaching framework to be very valuable. So we are recognizing the importance work that we do as professional coaches, as well as therapists and psychologists. So with that, I think we are all waiting to hear from our experts this specific question, which is, how do we find the difference, or what distinguishes these two professions? I think that's a very important question. I believe as professional coaches, when we go through our educational journey, we learn about the differences and similarities between certain professions: counseling, therapy, and then mentoring, consulting, and many other professions. Now, let's hear truly from experienced professionals what are some of the factors that distinguish these two professions, and also some similarities that you may experience. Over to you.
I can kick it off. I really like to look at like making things really simple for myself, like quick and easy tips. And my biggest one is the difference is the past versus future and really the wall that separates them. And so how I identify that in session or in conversation to identify, is this something that's really past focused or future focused, is where they usually hit the wall and how often they usually hit the wall. So when in a coaching session or a conversation about the goals, it's what does the wall usually look like? And is the wall about your processes and your tools that you currently have each day, or is the wall about I can't do it because when I was young this happened, I can't do it because this always happens, and it's that same theme. So one that came up with a particular client was father, and how she trusted and treated her husband, then how she trusted and treated her boss, and how she trusted and treated in different individuals that had the same characteristics as the father. And so if we keep going back to this wall that you can't do it because of this relationship with your father, that's the wall. Now we need, that's something where I can do the tools around the work for forward focus, but we can't go back and really understand what's happening with him to get you present, because coaching really is about that, starting from a present whole person focused on the future. So to me, it's really looking at that wall of past versus future and how often you hit that wall.
Thank you, Lauren. Susanna has a question for us, like, what do you mean by hitting the wall? And I believe, Lauren, you added some ideas on that. So Susanna, if you would like to know further, feel free to let us know. Thank you, Lauren. How about you, Anita and Emily?
Yeah. I think that's a beautiful metaphor, Lauren. For me, when you said wall, no, it is like a dead end, and we need to look for new directions. We're not progressing further. Yeah, I would like to share it with an analogy. If you see, if you take physical health, it is very easy to understand. For example, somebody who is an athlete wanting to train himself for a marathon would want to strengthen the capacity, will go to the marathon trainer, get trained for some strengthening, go to gym and all those things, where there is a goal for him. The goal is that to run the marathon. Okay, so then now it is in future. Okay, so then it's in future, there is a goal, and the performance has to be increased now to run a marathon. Maybe he is running like 5 kilometers, 10 kilometers, or 20 kilometers, but 40 plus kilometers is something, the huge. And so that is how I see coaching is something like, future focused, goal oriented, and there is an action plan. He's making an effort, and the one thing is he's healthy, he's normal, healthy. There is a goal where he's willing to make actions, so make efforts. So that I would say as a coaching domain. So then when we come to the therapy, right, say somebody who has had a ligament tear, where normal walking itself is a difficult for him. Now what does he do? He goes to a doctor, right? There is the ligament has to be in certain what do you call condition, normal functioning condition, which is not there, and there needs to be a treatment to fix that, right? There is a problem there, for the normal functioning. Say that is how I say that therapy is more like a, as I can say that already there is some injury in the past, right? And it is a problem focused, and normal functioning is difficult. There, whatever potential the person could play, that is hindered by some problem. That is how I would like to differentiate between coaching and therapy.
Excellent, Anita. Thank you. Great metaphor. It explains it very well in combination with what Lauren shared with us. Thank you. Emily, would you like to add some insights there?
Well, I couldn't say it any better than either Lauren or Anita. And I love the analogy to sports. I use that all the time as a former ski coach. What I would add is just saying in a different way that it's really about moving forward versus healing past. So just to add on, I couldn't add more. You both covered it very well.
Thank you. Thank you, panelists. Extremely valuable to understand this from a practical perspective. Now, with that, there's a baffling question. So I think it's important as professionals that we are straightforward. We are sincere about the services we provide. At the same time, what brings us to make us able to deliver these services that we deliver very passionately. So the question is that, as we are aware, if you look at the starting point for a professional coach, often if you look at the ICF professional standard, with 60 hours of experience, 60 hours of coach specific training, we are able to become a certified professional coach and start delivering coaching services to our clients. Now, the word injuries came up. So basically, if you look at injuries, there could be certain developmental challenges, childhood adversities, or traumatic experiences, like very well Anita explained. And often these adversities or the impact of them could be unconsciously hiding within ourselves, if not your clients, your coaching clients, where they might not even know that there's an injury, right? So as a professional coach, for an example, if we completed 60 hours of education and then we step into working with individuals and we look at them holistically. So my question to our panelists, and also invitation for our coaches to reflect as well, is that how important is it for us to not only be aware of how to implement coaching competency, but also to be able to recognize those walls, if not injuries from the client's past, in terms of determining whether coaching is the right avenue for the client. So how far should our education extend specifically as a professional coach in order to create holistic development in our clients without turning a blind eye to certain injuries, certain walls that our clients may have come across?
Yeah, I mean, definitely, it is very important to understand, the client from different perspective. If the client is coming for coaching per se, and there could be various scenarios with that. First of all, what my experience, what I have seen is that, especially in India, I work with NRI clients also from US, Canada, and UK. But what I have seen is that when people come to me, they come with a problem, and they do not know whether it is coaching, therapy, counseling, mentoring, what will help them. So now, understanding why they are reaching out to me will give an idea to, say that whether it is a domain of coaching or therapy. Once the client enters it, assume the client enters into the coaching only, but lot of other things can come up. We may feel as a coaches, many of you might have faced this issue during the after 2, 3, 4 coaching sessions. We may feel that client is not progressing. We are in a stuck state. So having an awareness, understanding information about, mental health aspect of it. Probably a client may not be able to, has a tendency to procrastinate. Procrastination can be a very common topic in coaching. So the client may have procrastination because of various reasons. There could be underlying anxiety there, or a depression, or the client may be neurodiverse also. Client may have the condition of ADHD or learning disability, which is causing lot of anxiety. When the coach is aware about the symptoms of these things, then the coach will be able to redirect or navigate the sessions accordingly, and vice versa. Because see, I work with geriatric clients. Most of the old people are brought by their children, but some of them they come on their own. Initially, I usually see in the geriatric population I get, there's a lot of anxiety after the fall. Coming back to the normal functioning, there is a challenge with the old people, which because of the fall, there is a lot of anxiety kicked in. So that is the initial therapy domain to help them with anxiety techniques, bring awareness about anxiety, what is happening, whether their fear is real or not. And after 2, 3, or 5 sessions, then slowly that moves into coaching, because for geriatric people, we need to set a routine for them, right? That is more into a coaching domain. So now as a therapist, I cannot stick on to the counseling therapy, trying to use different tools and techniques to help them. That will not work. So having understanding from a different, the methodologies domains is very important. We need not have the expertise, but having that awareness is very important. If you don't have that expertise, always we can actually refer them to the another expert. Yeah.
I think one of
Thank you,
the
Hanu.
pieces of that she mentioned is that ability to function on a regular basis. So as a geriatric patient that is having this anxiety, it's preventing them from doing the things that they normally do. That's usually the key thing in what deems something a diagnosis. And so if you notice, that's essentially what that wall is built out of. It's that functioning ability. Is this mood consistently impeding on their progress towards their day-to-day life activities, not only their coaching goals? That's one of the indicators. So I would say it's the level of which they can function with the thing. I do think it can be really helpful for coaches to look at those key or high diagnosed issues like depression, anxiety, even trying to understand the learning disabilities. I think that's a huge thing, because there's a subset of people that because of the labeling that came about and because of the stigmatism that came about, there's a lot of people that don't have labels that they could have benefited from as children. And these learning disabilities or these learning issues have then morphed into other things that do impact people. So kind of recognizing that wall comes from recognizing the wall is built from levels of functionality. How can I function with this? Can I or can I not? I think that's a really great indicator to point out.
Yeah.
Thank you, Lauren.
I would add to that, that, they're finding that trauma or like ADHD and anxiety, depression, all those things, right? They come from depression. Even the learning disabilities and all those kinds of blocks that cause us to have those diagnosable conditions, right? And so when I can really appreciate my training and understanding around therapy and diagnostic conditions, because it helps me key in on why someone might be procrastinating, why someone is blocked from a certain thing. And, of course, we can do therapy, we can do coaching and therapy, but we can't do therapy and coaching. And that gets a little tricky there, but that's when you know how to send it on to a professional therapist.
Excellent. Thank you, Emily. I think as three of you are sharing from the mental health care professional perspective, how you approach the distinctions between these two professions or the practices, I think we are starting to understand the importance of the coach being aware of the potential adversities or certain conditions or underlying situations of our clients. And there's a very interesting question from Vidya Lion, I think. I'm sorry if I pronounce your name wrong. Can anyone without masters in psychology be a coach only by knowing the coaching competencies? I think I would take this question if you don't mind, panelists. I think this actually really depends on which regulation body are we talking about here. As I mentioned at the very beginning, coaching and even therapy is not necessarily regulated throughout the world by government entities. Now, if you look at the western part of the world, especially the US, many countries in the Europe and Pacific, for an example, Australia, there are very clear guidelines in terms of how a coach can practice, what are the requirements, and how a therapist can practice or a psychologist can identify themselves uh, as a professional designation. We would say in therapy world, there's a lot of regulation, although many countries still need to regulate the profession, mental health care professionals. Unfortunately, coaching, I believe, is still an area that requires a lot of regulation. Now, interestingly, most coaches who are out there, statistically speaking, based on ICF, the annual studies, we notice that there's a huge number of professional coaches who operate with either 60 hours of accredited coach training, or they have obtained, for an example, ACC credential. So if you look at simply the ACC credential, we would say the coach has at least 60 hours of coach-specific education, some mentoring supervision, some professional requirements, plus at least 100 hours of experience. So the question that Vidya is bringing out is an important one, because I am unaware of any authority that stipulates that or has made a mandatory requirement for a professional coach to have a bachelor's degree or a master's degree in psychology, coaching, or any other specific area in order to practice as a professional coach. So for an example, someone with the 60 hours of education, they're able to operate as a certified coach. After this 100 hours of experience with the ICF credential, they could operate as a credentialed coach. And of course, we know that that's just the very beginning of the coach education. If you look into ICF framework, then we have the second credential, which requires at least 125 hours of education with 500 hours of experience. And then if you look at the master certified coach, you need to have at least 200 hours of coaching experience with minimum of 2,500 hours of client delivering coaching to clients experience. When it comes to master certified coach, MCC, I believe, as these 2,500 hours of experience requires several years to generate, naturally, an experienced coach who is applying for a master certified qualification have gone through many different trainings way beyond 200 hours. So I would say it's an interesting question for all of us. Coaching is relatively new to the world. If you look at it from ICF perspective, it's about 3 decades coaching has been existing as a professional practice with an accreditation. So I think there's a lot of work that we all need to do in understanding how much of education and how responsible we need to be in approaching delivering coaching to our clients. And I think this is an important question. And I think that's why we are having this kind of conversations in order to educate and understand the depth of the work that we do. The reason is because we work with human beings. And as we talk about human beings, our mind is everything. So if our world revolves around how we think, how we behave, how we feel, among many other things, how we build relationships, for an example. So having a deeper understanding as a professional coach, not necessarily therapeutic modalities as such, but some level of understanding of psychology, neuroscience, human behavior, certain psychological theories evidence-based research, I believe, is absolutely very important. Vidya, I see that you have raised your hand. We would love to hear from you some of your insights.
Uh, Hello, everybody. Thank you for creating this panel. And this is something that was very close to my heart, this topic. And I've been a coach for a few months, but this thing of therapy and coaching is actually putting me behind. My daughter is neurodivergent, and I have been through it, and I know how it is. In fact, I homeschooled her for a while because she couldn't fit into the mainstream school. And I worked on her personally because I did not have enough support at that time. Today she's gone to Melbourne and she's studying on her own. She's independent, so she's doing good. So now that she's independent, I thought I should go back and help people, parents out there who are facing similar issues. Now the problem is I do not have any masters in psychology. I just have the intention to help people, and that's all I have, right? Um, Now with only ICF competencies, I am not very confident about how can I go ahead and help everybody. Now, a classic example I can give, like what Anita said, like a person who's wanting to run, like he's being coached to run. If there is an injury, the injury has to be treated. Now, my daughter used to practice for badminton, and she used to do a lot of training for that. And her coach did not have any information about the anatomy, right? And she fell down during the practice, and he made her get up and run again. And that made it worse that she had to be home for 3 weeks. So this is a classic example where we say that you have to work on it, but if the person doesn't have, so what I am trying to understand is how can I be a better coach without even having a supportive therapy information? I can be an executive and a leadership coach, that's fine, but I think coaching parents, teenagers, adolescents is a huge responsibility. And I feel that we need something more than ICF there. That's my question. How do we do it?
Thank you, Lauren. That's a very responsible approach that you're bringing up here. And I think that's also the reason why we are having this conversation, in order to open up and learn from our panelists, experienced healthcare and mental health care professionals. Emily, I thought there's something that you'd like to share there.
Yeah. So, in therapy, we're more about diagnosing disorders with trauma, right? And diagnosing something in particular. And then we have these clear sort of ways in which we can apply like CBT, DBT, ACT, all those kinds of things. Whereas in coaching, it's more of a co-creation, right? Where the coach doesn't tell the client what to do, which it sounds like this coach told her what to do, get up and do this, instead of checking in on what does the person need. To me, that's a real clear defining difference, because you don't have all the information as a coach. Whereas as a therapist, you have this guidebook that can help you diagnose versus moving forward to co-create. So that's how I see it. If the person can't get up, then as a coach, you should be able to say, okay, there's something more here that I'm not skilled to diagnose.
Yeah.
Does that help?
Very helpful, Emily. Thank you. Anita, over to you.
Yeah. So to add on to what Emily said, say if you're looking at helping neurodiverse people, there are multiple options. As one part is diagnosis, as Emily said. So if you when it comes to children with neurodiversity, it is little different, and with adults it is little different. Now, many a times for children, it becomes very necessary to get them diagnosed, because it may affect the academics, right? So then you can build an ecosystem for that. and refer them to clinical psychologists. I'm not sure which part of the world you're from. I'm assuming you're from India.
I'm from
So
Pune and she's diagnosed. Yeah.
yeah, so now for children, no, you can RCA licensed therapists, clinical psychologists can do the diagnosis. You can take the help from them. For you to, you can still continue coaching the neurodiverse adults, especially. May not be the children. Well, for adults, what you can do is that having a very thorough knowledge about, no, the neurodiversity is the three spectrums are there, right? Say which one you can choose, which one or something. And I was looking for something. There are some international certifications on ADHD. If you're looking ADHD as an area, coaching certification for ADHD is there. So you can explore something like that, add on to your existing coaching skills, build on a specific niche, and also you can continue to help people.
Yep. I think too, one of the big indicators there is using your coaching skills and knowledge to help you identify when it's time to move that way. So one of the glaring things that I was hearing about that coach is in that moment, his awareness of what was happening with the client, your child, wasn't there. It was more so about, let's continue on this path that we're on. And so as a coach, your role is really to be very much aware with yourself and what's happening in this moment. How is it impacting the client and their ability level? So for instance, if I'm a client and we're on a call and I'm saying, every time I try to follow through with my action that I've said I'm going to do, I break down into tears and I start panting. I have this really visceral reaction to it. My emotions go crazy and I can't control myself. As a coach, that's not my avenue, because that's something, one, it is in the past deep that you're reacting to. That's a physical reaction the client is having. So when you can be present enough with the client to recognize the thing that they're saying is coming from somewhere else, that will help you to be able to identify, oh, I do need to refer out. And agreed, there's levels of which you can refer out. I think it could also be helpful for you to, and for when we're in these situations, to one, try to educate ourselves on the things that could be surrounding the area that we work with. Like, what are those comorbidities, so to say? Like, what are the things that come up for clients that are dealing with this issue? So neurodivergent people usually deal with what? And then go learn about those things so that you can more so identify them when they're coming up and not work on them, but put them to the people that they need to have them worked on with, or to have that distinction based on what's in your area. So that's my thought on that.
Thank you, Lauren. I'm so glad that as our panelists are sharing their insights, we are clearly starting to notice that some of the skill sets that we already possess as professional coaches enable us through the inquiry, through the somatic observations, through what client is telling you and what client is not telling you. We are actually able to recognize certain aspects where the client might be needing support from another professional beyond a professional coach. So I appreciate your sharings, panelists. And I think just to add a little bit there, I think something also is important is that like what Lauren and Anita both mentioned, when there's a specific sign visible to you very clearly, you are able to gauge and recognize that the client would need the assistance of a therapist or a clinical psychologist. At the same time, however, Anita was earlier talking about procrastination. Sometimes the client might not directly know where did that anxiety that contributes to the procrastination started to begin with. They may have disassociated, which means they may have completely forgotten where the origin is. Or sometimes origin may be multiple reasons. We cannot necessarily pinpoint always to just one thing. Now, also something that we all know about is when people have experienced adversities, deep challenges and traumatic experiences in their life, there's also interestingly somehow shame and guilt attached to it. So if I use this as an example for us to recognize, as professional coaches, somewhat we become the cheerleaders of our clients. professional coaches, we celebrate with our clients their success. And we are also, as we are aware, coaching is a reflective and goal-oriented, action-oriented process. So what we do is we help our clients to set goals and then achieve them. And we motivate them, encourage them, we even challenge them. Now, imagine if a client keeps coming back to you without being able to achieve those goals that they say they want to, or take the actions that they undertake. You notice that itself is an indication for us to recognize that there's something beyond what is blocking them taking actions. They're very committed, but they're unable to. So right there, we have a little bit of an awareness. But at the same time, let's say if we were not aware of how one could procrastinate, what could be the root causes of procrastination, for an example, we might continue to challenge the client. We might continue to motivate the client. Then you may notice if the client is going in a cycle of not being able to achieve this goal, they might create a deeper level of sense of guilt, sense of shame, for an example. So we are aggravating their situation. If not, we are kind of giving them a trigger to activate these unconscious responses that they have already instilled in them. So we could potentially do damage to our clients rather than truly helping them. So I think this is why it's really very important that we have the right knowledge to recognize, not diagnose. That's not our profession. That's very important. So with that, all three of you gave some indications already how to identify when the client needs something beyond coaching. So if I may invite our panelists to share with us a little bit of tools that you may be using in terms of diagnosis, or if not, in terms of being able to recognize. The reason why I said little bit, the reason is coaches are not necessarily qualified to diagnose mental health conditions. So if I directly open up to you what indicators you use, you would probably say DSM, which is the Diagnostics and Statistical Manual for Mental Health Disorders. Well, that is a technical manual, which is not going to be conducive for professional coaches. Of course, we can read and understand it to a certain extent, but it's a technical documentation. So if we go beyond DSM, if I may invite our panelists, what are the methods, tools, techniques that you may be using or you recommend professional coaches to use without being a clinician in order to gather enough information to be able to refer the client to a mental health care professional?
I think as the somatic awareness, we can ask our people, ask coaching clients to be aware of. I believe, I can't remember whether it was Anita or Lauren mentioned, when a client is having these feelings, that's a really good indicator for one, the somatic, meaning where are they feeling it in their body? And the other one would be, their focus, their ability to, what are their thinking patterns? Right? Are they cycling? Are they ruminating? Are they, does this happen for them? Those are some really simple ones and not diagnosed, but they are patterns of behavior that can be identified by a coach that can allow you to understand that maybe there's something more behind it.
I agree. And I don't want to mispronounce the name, but there's a person in the chat that identified the being very conscious of avoiding bringing your own agenda to the conversation and staying very curious. That staying very curious and present and making it a practice to write down the themes that you're noticing and what actions or behaviors are associated with those themes for the client. So that basically means that you're staying very aware. This could come about with how you prepare for your session. So in the last session, I wrote down blame and fear and in the chest. Next session, I wrote down shame and confusion and in the chest. And it keeps coming up. So this is a way that I, as the coach, am staying very present and curious about what's happening, what's it looking like, and inviting them to explore for themselves. It sounds like each time we talk about this thing, this happens. And letting them in, transparency as a coach, letting them in on your thought process of this could be going down a road that I don't that is out of my scope. Not that we can't discuss it, but that we can understand who would be best equipped to help you with this. So I feel like that transparency and self-awareness piece comes in very strong in your ability to help yourself and the client identify when this is an area you can't go down. I'm also one of those people that needs like to read something about it. So the ICF does give us like a in-depth look at the differences and how to support that. So I have it on my phone. I'll pull the link and drop it in the chat for you guys to be able to go through that white paper. But recognizing the curiosity that you're able to bring to the conversation, I think is going to help you identify what's happening. Your presence in your notes, I think, is going to help you to identify if this is not yours, or this is not something that's within scope. And I can't stress enough that what's in the chat of making sure that it is related to the client's goal. So if the client keeps getting blocked to reach their goal, what are those blockages? Those are the very, very good key indicators of this is somewhere else. And oftentimes too, just because, you know, I have the health and wellness distinction, I think it's important to recognize that it's not always just psychological things that people have these blockages on. You know, I've been out of breath a lot. I get overheated every time I try to do, you know, the goal is to organize my home. Well, sounds like, I don't know, is it breath? Is it high blood pressure? Like, is it there's a million different things that could happen. So that curiosity and staying curious with the questions can be very, very helpful in that situation.
Thank you, Lauren. I think, Mridul, thank you for sharing your insights, which provided us a gateway to, Lauren, to further elaborate your sharing. Mridul, would you like to add anything there from your perspective?
I'd like to add something.
Oh, I think he was muted.
Oh,
Uh,
was someone
yeah.
talking? Okay.
Sorry. No, I wrote what I had to say, so nothing to add here.
Thank you for the insight, Mridul. Over to you, Emily. And then
My
Anita.
personal experience of when I was going to a therapist for anxiety, or I started to go to a therapist for anxiety because I was short of breath all the time. And I felt tingling, and and I went to a therapist thinking it was an emotional thing. And the first thing the therapist did, luckily, was go get your blood pressure checked, go to your doctor and get your blood work done. It was blood pressure. I took blood pressure medication. I was fine. There was no psychological so just to add on to what Lauren said about that.
So thanks for bringing that experience, Emily. Yeah, definitely. Before venturing into not thinking that it is a mental illness, it's very important to rule out the physical health issues. When coming to diagnosis, right? Say how I see it as diagnosis may not be required always. Means diagnosis means what? There is the proper test, psychometric test or something done. There is a report on that. All those things. It is something like we go to doctor, and if there is it's a viral symptom, based on clinical symptoms only, doctor will start giving us medication. So he may not advise us to go get the blood report done always. So it is something like that here also. So now we know, asking a simple questionnaire like Lauren and Emily were sharing, simple questionnaire about, say, you're suspecting anxiety. Okay, just 2-3 questions on whether it is manifesting in cognitively or whether it is manifesting physically. You ask some questions about how they are physical discomfort, what is happening, are they having racing heartbeat or shortness of breath, kind of a thing will help you to identify. And with that, actually the coaching or the therapy sessions also can go forward, unless it is very severe in nature. Or with respect to children, diagnosis may be required, because if there is a OCD or anxiety which is coming in between their academics, So there is a report required where you need to produce it to the school and whatever for the some procedures to follow. Otherwise, I think simple questionnaire, knowing about the symptoms of these things and having a simple questionnaire prepared in advance should help.
Thank you, Anita. I think great insights are coming through, and I also believe that we are starting to recognize that although as a professional coach, we may not have extended education on psychology, neuroscience, behavior, at the same time, utilizing our own coaching skills, we are able to gauge potential needs of the client as a co-creation, which Emily used earlier. So maybe I'll ask this question on behalf of potentially other coaches who are here. And also one of the things that I forgot to mention at the very beginning, those who are joining this conversation till the end, up until the last 10 minutes, we are providing you with the 1.5 ICFC CEUs. So stay tuned. I will be sharing the link in another 10 minutes. I believe, of course, as we started this conversation, I think it only could get longer. It's becoming more and more interesting. Considering we only have another about 15-20 minutes left, I would like to invite our panelists to reflect a little bit. Now, let's say you yourself have the experience of coming from different industries, different backgrounds, and then going into becoming a therapist and then continuing your journey as a professional coach. So I would like to understand from your perspective, especially if there's someone listening to us today and reflecting deeply and responsibly. I have received 60 hours of coach-specific education or a specific number of hours, and I come from a different background. So what would be your insights to share with them? How do you believe expanding the education, learning more about, for an example, psychology, different types of diagnosis, and then also specific physical conditions that contribute to manifesting as a mental disorder or emotional challenge or something like that? What's your insight about expanding further education as a professional coach, not just only the coach specific education, but also other related fields?
Okay, I was like, I'm very excited about this question. I would say the biggest things are staying curious. Number one, always, always, always stay curious. And then think about how you can educate yourself continuously. I mean, that's a part of your certification anyway. So how can you continuously educate yourself when it comes to these CEUs? Not just looking at your particular expertise area or the area that you like the most, look at all of the options that there are for the CEUs. Do something when it comes to, even if you are focused on parenting, look at one on leadership, look at one on holistic wellness, look at one on trauma informed, like just expand your education across the board as you do your continuing education. I did drop in the chat this like wonderful 24 pages on what ICF likes to explain or how they like to define it, and then giving you like little bitty cues on when to refer, what are these things that you can look for. And then use your clients as your compass, really. You recognize things are happening that you are unsure about or themes that are coming up for them. As you're preparing for the week, as you're preparing for sessions, look up these things so that you can begin to have your own personal set of awareness of what's happening. So that personal education based on your clients, then education based using your CEUs, and remaining curious, I feel like can be very, very helpful.
Thank you, Lauren.
Yeah.
Yeah. So, how I actually expanded my education or expertise in different area is that I would say it's like a three-pointer thing. One is my passion, another is need and market. So once I started coaching and counseling, anyways, we track our, we have the log about, hours and patient details and everything. where I started seeing that a lot of clients coming to me were from they had a lot of anxiety and thought related issues. When I say thought related issues, nothing psychosis, but more of a negative thinking, intrusive thought, overthinking. So that led me to, look for to know more about anxiety. How do I, understand or educate client about anxiety? And what are the techniques? Intervention, right? Say for if somebody goes to doctor for anxiety, they will give medicines. But as a therapist, what I can do as an intervention? I know these symptoms, but how do I do intervention? So that is when I started looking for some courses which are more specific to anxiety management. And also, the lot of clients were coming with thought related issues that called me to learn for CBT, cognitive behavioral therapy. So, and other, this is about expanding education, but I would recommend you also have to keep in mind that so whether if you are a practicing coach or a therapist, the business also becomes important, and you need to see that whether there is people are willing to go take professional help for these things. That also you can say, if you track your log, keep your log very diligently, capturing your client details for over a year or 1.5 year, probably you will have enough data to identify and plan for that.
What a wonderful thought, Anita. Thank you.
I just had another thought too from that, that I don't think we've discussed yet, is the recognition too that just because you identify that this is something that is best suited by another helping professional, your client might not agree or be ready to take on that other helping professional's help. So you also have to recognize when it is appropriate to say, we can't continue discussions that lead us here, or each time you get to that space, you have to hold up that boundary for your scope as well. And just because they don't want to go doesn't mean that we help them in that area. It means that we continue to identify for them that this is best suited with another professional. So I think that that's really important to remember, because we want to help people, but we can't cycle into, well, they won't go to therapy, so I'm going to help them with their mommy issues. Nope, we can't do it.
As far as, training and development, I think self-awareness is really important. Doing the assessments around your own behaviors. You can go online and you can Google, what's my attachment style, and take a quiz, right? I mean, you want to make sure the resources looks good, right? That you're Googling, but you can do their enneagrams on behaviors. There's emotional intelligence. There, all these different things that you can do. But trauma-informed care has really picked up, and there are a number of trainings out there that you can look up and go to. I've learned a lot about back pain, for example, through trauma-informed care. It is really part of trauma. Sometimes it's because people hold trauma in their body, their nervous system changes, their DNA even changes. There's all these things that you can learn about what trauma does to the body. And I had a client talking about she couldn't go into the executive room. She could lead and manage everyone great laterally, or, subordinates, if you will. But when she had to walk in and present to the big guys, it was, she couldn't do it. And that came from trauma, which we later learned. So trauma-informed care would be my number one recommendation. And self-awareness.
Brilliant, Emily. Thank you. I see that there are some book suggestions coming through as well, like Body Keep the Score, Attach, for example. There's many, like some of the psychological concepts that were mentioned. Most of the time we can find some research papers, if not commercially published books. So I am right now sharing the registration for the CCEU, and this is only available to the professional coaches who are joining live in this session. And Thank you, panelists. I think the more you share how coaches could approach a more mindful, responsible practice, you are helping coaches recognize the gifts that they already have or we already have, which we can use as a tool, way of measuring very mindfully with heightened self-awareness, like Emily said, and also as Anita and Lauren mentioned, expanding our awareness on different psychological modalities, of course, based on correct information, and knowing our limits can be extremely valuable. I think this is also an important, like I mentioned, as professional coaches or any professional, especially in the mental health care space, I believe it is important that we reflect, because as therapists and coaches, the main driver of our practice is reflection. So reflection is part of a very big part of who we are as mental health care professionals. So I would say, even if we may have received limited education, it doesn't necessarily mean that we may not be able to help someone. The further our knowledge becomes, the better we can provide the services. I think the very specific reason why I'm saying this is, as a coach, educator, and a mentor, I often notice that there are many, I would say, myths or marketing promotional material. Often if you are browsing through your social media, often there are advertisements which say, imagine waking up as a nomad in the beach, and you have this 7-figure income coming through and all of that. I think it is true to many professional coaches, but we also need to understand that it may not happen immediately after 60 hours of course specific education, just going out there. And if we expected people to knock on our door right outside with a queue of people, I think it may not be realistic. So it's important that we are recognizing, with the education that we receive, preliminary education that we receive as a professional coach, with all the guidelines certain accreditation organizations provide to us, we are able to start working with individuals. And now we are clearly seeing the importance of expanding our awareness, self-awareness to begin with, expanding our education in every direction that we could, and then also crafting or mastering our own craft in order for us to be able to recognize what is happening. This is what I'm hearing. And I think at the same time, very new coaches make the mistake of this passion to help, the passion to deliver services. We want to work with everyone at the very beginning. I made that mistake myself. So it's very important, as much as we are passionate to help someone, asking ourselves, is this the right type of service that I can truly provide to this person to help? So being able to recognize if the client is seeking some other professional service. I think this is very important. So it's all good news. I'm glad that there's a way for professional coaches to continue their impact. So as we are coming to an end of the time that we have today, unfortunately, the conversation could go on much longer as it's becoming more and more interesting. I would like to quickly invite our panelists to share their final insights. Of course, when we initially had an internal conversation, we wanted to address many questions. At the same time, we recognize that this is a truly an important topic which has a lot of depth. So the time just flew by. So with that, panelists, what gifts would you like to leave with our viewers and also our live audience today? What insights would you like to share in continuing providing services as a professional coach, yet be informed of trauma or psychology, neuroscience, and other related areas that would intersect coaching and therapy? Over to you.
One thing is, yeah, definitely when we, for me, the insight I would like to share is that when we work with the clients, the focus is on clients' needs and whether do we have appropriate, be it qualification, certification, expertise to help them. We may be doing an eclectic approach where we may be clubbing different tools and techniques from different methodologies, but is it for the client benefit? Do they enhance clients' experience and outcome? I think that is one thing which, as a coach or a therapist, we should keep in our mind. It should be more for the client benefit, client focused, rather than a coach or a therapist benefit. So always the client, confidentiality, the needs of the clients has to be kept in mind. That is what I would like to share.
Thank you, Anita.
I guess what I would like to leave with is to remember coaching. Some people don't always know the difference between coaching and therapy, and so they may start talking about, things that are grief or trauma or, those kinds of things. And I guess the gift I'd like to leave is to understand I would never push a trauma client or a therapeutic client the way I might push a coaching client. And I do, in my intakes with coaching clients, ask them if they are familiar with trauma, have trauma in their backgrounds, and are they receiving help with that. So just asking it right up front if that's part of their life and their development, personal and professional. It's okay to ask.
Yeah, 100%. I think what they said for sure. And I guess the biggest thing for me is that you remember to stay very, very aware and transparent. I think a lot of times we kind of get into holes because we ourselves are a little bit afraid to say, I can't help with that. And so being very aware that we do have this scope and limitations, and that is very supportive to them, that can be very helpful. So staying very curious and self-aware and transparent, I think will help, because the more curious you are, the more you're going to go and learn. The more transparent you are, the more they're going to know the scope. The more aware you are, the more you're going to know how to utilize both of those things. So I think those are my things that are big to take away.
Brilliant. Thank you, Lauren. Emily, Anita, anything else to add here?
You're already here doing it, seeking this out. So believe in yourselves.
Yeah.
Yeah,
And I
I
think over to you, Anita.
yeah. So there's a lot of the mental health over the world is now there is a more awareness, and a lot of things are happening which are promising and positive. Be it a coach or a therapist, there are a lot of opportunities out there, and comparing with the statistics of the clients versus the therapist or coach, it is still skewed. There is a good amount of opportunity, and it is my experience is that it is a very fulfilling work I'm doing, and I think most of you resonate with that. All the best for your future endeavors.
Thank you, Anita. I would also like to, Lauren, do you mean to?
No, I think everyone is, yeah, I agree with what they've said. I feel like we've hit the nail on the head a couple of times, so I'm good.
Excellent. All right. Okay. So I think I saw a question earlier. Are there specific? I don't remember exact question. Like, what are some of the opportunities in terms of continuing education? I think Anita mentioned earlier there are very specific ADHD code-specific trainings, for an example. In fact, I'm aware that there are few ICF accredited programs specializing ADHD. As I mentioned at the very beginning, at Ignite Global, for an example, we deliver trauma-informed advanced coach practitioner, which is fully ICF accredited. We deliver a child, adolescent development and parenting coach, advanced practitioner for both level 1 and level 2 ICF certification, for an example. So I would say if you look closely, for your surprise, you will find that there are many programs which are accredited by the ICF, clinically aligned, and also explores beyond the traditional core competency framework. So if you keep an eye on, like what Lauren said, if you're collecting your CCEs, it's always good to look at specialized coach education programs, which would not only provide you with the information and knowledge, but also support you through your credentialing process and professional development process as well. And also, the word CBT came up very often in this conversation, cognitive behavioral therapy. If you notice, there's cognitive behavioral coaching at the moment, solution-oriented coaching, coactive coaching, humanistic coaching, and also from a trauma-informed perspective, coaching that can be combined with psychodynamics. There are so many opportunities for all of us, and I think we live in such a wonderful era right now because they're available to us at our fingertips. So with that, coaches, therapists, leaders, and those who are curious today, I hope that this conversation created some value for you. You will walk away from this conversation empowered. And most importantly, I would like to sincerely thank Anita, Emily, and Lauren for being here with us today, sharing your insights and expertise. And I believe that you have given us a new hope and an intention to expand and undertake this profession responsibly and mindfully. For that, I deeply thank all of you and look forward to co-creating and collaborating again. Oh, so with that, I would like to mention, I love exploring different aspects of coaching or related aspects. So like today, we talk about intersections between coaching and therapy. In our next webinar next month, I am planning to bring in 3 High Court judges and talk about how coaching is creating massive impact in the judiciary system in the US. So I look forward to seeing you next month with this webinar, and I'm determined to continue this series into the next year, and I hope you will be joining me in these enriching conversations. Thank you, everyone. I look forward to seeing you in the next session. Bye for now.
you.